Welcome to Community Health Matters. I'm your host, Amy Marsalis. In today's show, we'll cover several important topics, including one that's been in the news a lot lately right here in Tennessee, the Zika virus. We'll also share strategies that parents and adolescents can use to combat bullying. And finally, we'll talk about the link between behavioral health and physical health issues. All of that coming up next on Community Health Matters. From the News Channel 5 network, this is Community Health Matters, sponsored by the United Health Foundation. And I'm happy to have Dr. Abelardo Moncayo here today with the Tennessee Department of Health. So nice to see you.
Thank you.
And we know that the Zika virus obviously has been in the news so much in recent months. You are head of this program at the Tennessee Department of Health. Can you describe to us what exactly is the Zika virus? We know that it's carried by mosquitoes, but what else do we need to know about it and be better prepared to protect ourselves?
Sure. So yes, the Zika virus has made many headlines in the news, mainly because of its effect on the fetus of pregnant women. So it causes what's called microcephaly, which is the fetus has a smaller brain, and so it has a lot of issues, cognitive issues, and maybe issues that we haven't yet understood, because a lot of these children are being born as we speak, and we're following them. So because of that, it's made a lot of news. But we have had mosquito-borne viruses in the United States for quite a long time. And, you know, it's probably something new to a lot of us. For myself, for example, growing up in Ohio, we didn't really think about mosquitoes as a danger as far as viruses. They would just be a nuisance. But now, since things like West Nile virus, for example, we understand that there are viruses that are endemic to the U.S., but also that are coming into the U.S. And Zika is one example of a virus that has a potential of coming into the U.S.
Okay, so you get a mosquito bite, you're worried about it. What would the symptoms be of that you were bitten by a mosquito that was carrying the Zika virus? So
the people that should most worry about getting the Zika virus are those that travel to countries that have Zika outbreaks going on right now, which are, for the most part, most of Latin America and the Caribbean. And the symptoms are going to be a rash, fever. Those are the two most common symptoms. Also conjunctivitis and arthralgia, which is, so conjunctivitis is reddening of the eyes, and arthralgia is joint pain.
Can you get it from another person? What is the means of transmission other than getting the mosquito bite?
Sure. So there are actually multiple means of transmission of Zika virus. So in one sense, it was not unusual for us to see a virus like this emerging. We saw before this virus, chikungunya virus, a couple of years ago, that had a similar pattern. Starting in a different part of the world, Zika virus started in Africa and has moved through the world and come into the Americas. So that's not unusual, that mechanism of movement of a virus. But what is unusual is Zika virus itself. It is not just transmitted by mosquitoes, but it's also transmitted sexually, and also from mother to fetus. It's transmitted sexually, and for a while we thought it was just men to women or to their sexual partners. But recently we found out that it can also go the other way. Women can also transmit the virus.
All right. Is there any kind of way to protect yourself other than, not traveling to these countries, to Latin America, to the Caribbean, which we know so many people are. So many people are traveling internationally to those areas. What else can you do to protect yourself?
Well, so certainly the people that we're most concerned about and that we have recommendations that they do not travel are pregnant women. If you are a non-pregnant woman or a male, then there are things that you can do to protect yourself. So while you're in country, you can wear repellents that you can put on your skin. There's repellents that you can put on your clothing as well. To stay in places that have good screens, good air conditioning, that sort of thing.
What kind of treatments are available?
Right now, there are no treatments. They're working on vaccines for Zika virus, but that will take a while. So the only protection is prevention, and that involves mosquito prevention, but it also involves using condoms. If you are a male, for example, that has been diagnosed with Zika virus, and you don't want to transmit to your partner, it's recommended that if your partner is pregnant, that you abstain from sex or you wear condoms throughout the duration of the pregnancy. And if your partner is not pregnant, the recommendation is that you abstain or have protected sex for 2 months if you don't have symptoms and you've come back from an area that has Zika virus, or if you have symptoms, to do that for 6 months.
You also had mentioned prior to us doing our interview today that this is such an ever-changing situation. We've just recently learned of a case where someone that was taking care of a man who had traveled internationally got the Zika virus, who was, I believe, in South America. So what's the best advice to folks to stay on top of this and to know the latest information?
Sure. So that's very true. Right now, it's the summertime. People are going, taking trips. They're coming back. We expect to see more travel-associated cases as the summer progresses. So to get the best information, go to our State Health Department website or the CDC website, or simply Google Zika CDC or Zika Tennessee Department of Health.
Okay, ever-changing, evolving kind of situation. Thank you so much for enlightening us on the latest on the Zika virus, Dr. Moncayo. Appreciate it.
You're welcome. Thank you.
And we'll be right back after this. And Eric Johnson is the Vice President of Youth Development for STARS Nashville. You've got this program going, Move to Stand, for students to help recognize the harmful effects of bullying. I mean, it is a tremendous problem in the country, locally, everywhere with kids. Explain what this program does and how you really make an impact on these kids and get them to sit up and take notice.
Well, what we try to do is get all like-minded bodies the same, to come to one event where we get all the kids who have been bullied and harassed, the leaders, the bystanders, and we take them through this really interactive, full-fledged day where there's a lot of fun, there's a lot of excitement, there's a lot of education mixed in with it as well. And so we want to train young people on what bullying looks like, simple strategies on how to support those kids who are getting bullied and harassed, and we really want them to use the motto, Move to Stand. Physically move to somebody and learn how to stand and support them in healthy ways.
How dangerous is bullying?
It's very dangerous, and I think it's more dangerous because of the unknown and because of the things that people don't know about bullying, harassment, and the harmful effects and what it does to a young person, how it isolates that person. It causes a person to be very depressed, missing school, feeling like no one cares about that person. And so our program, Move to Stand, gives kids an opportunity to express that in a healthy, safety environment where other kids can see that and be able to understand what that young person is going through.
If you're a parent, how do you know if your kids are being bullied? I've heard that a lot of kids really withdraw.
Yes.
And really become quiet. But maybe you have a child that is normally quiet, or those teenage years, they go to their room and they don't want to talk to you anyway. How do you know that bullying is going on? What are the signs?
Some of the signs are just, unexplained bruises, ripped clothes, unexplained sicknesses when they decide to skip school, grades, dropping in grades, attendance, and behavior. And what I'd always tell parents is just ask the question. Simply ask that question. Are you being bullied and harassed? Are you being mistreated at school? And continue to ask that question if you feel like something is going wrong. And we generally can tell when a kid has lost appetite and interest in sports and things like that. So just continue to ask the question.
Are the kids afraid to ask for help? A lot of times they're afraid that those kids are going to seek them out and do even worse things to them if they are tattletales, if they tell a teacher, a parent.
Yeah, a lot of times kids are really afraid to just speak up because of it's very humiliating to know that, you feel like you're the weaker one and you have to report that to someone. And so what we like to do is come in and encourage them to say, look, these are some healthy ways that you can really go get help.
Give me an example of a strategy that you would use.
One of the strategies that we use is making sure that we get the bystanders to understand the harmful effects of it so that they can go be an ally to that person. And so one of the 6 strategies that we tell young people how you support someone who needs your support is basically speaking to them. And they tell us, don't speak to me by yourselves, but speak to me when you got your group with me, because that gives me value when you have a large group of people that's following you. The second way is just to give me a compliment. And so if we can empower that person who has been bullied and harassed to give them value, then they become less likely to be a target. And so it's really easy things that we can do. And what we always ask kids is that one of those 6 things can you do? Can you do one of those things every day to support someone? They're like, yeah. Can you invite someone to a social event? And that's not coming to your birthday party. That's inviting them to come eat lunch with you or come to a ball game. Something really simple. Can you send out a positive message on social media? Absolutely. And if you're afraid to do all those things, can you go tell a trusted adult? So there's some really simple strategies that young people can use so that they can support those kids who need it.
How do you change the behavior, though, of the bully? I would think that'd be the harder thing.
It's about creating empathy, and it's about being able to allow that bully to see and to walk in that person's shoes. And so with our training and with our programs, we get a chance to do that so that young people get an opportunity to see and feel what they're doing to someone else. And it's a really cool opportunity for young people to kind of like self-reflect and understand the harm that they're causing someone else. And on this particular day, in this particular training, they get an opportunity to repair relationships, repair harm that's been done over a course of years, months, or days. And it's a really cool transition to see those bullies be able to say, you know what, this is the harm that I've done. This is what I want to do moving forward.
This can really be life-changing, it sounds like.
I've been able to do this along with my colleagues for the last eight years, and we've been able to see the transition from young people from being unhealthy to being healthy to being leaders in the school to changing the school climate.
Tremendous. If a parent or young person is watching this today and they're being affected by bullying, whether they're the victim or the person maybe that is doing the bullying, what should they do? Is there a contact person, contact information you could share? Oh, absolutely. They can always contact us at STARS Nashville at 615-279-0058, or just go Google, how to stop bullying and stop.gov, no bullying, stopgov.com. And there's a ton of different really cool websites that you can get additional information. Go to your schools and ask principals. Google any nonprofit agency in Middle Tennessee, and there's a lot of strategies and prevention activities available and information to give to parents. Eric, bullying has always been around. Why do you think it's become such a hot button issue today? Is it because of social media? Does that have a lot to do with it? Oh, it's all those things. It's the quick access to put a harmful act
out there in cyber world, and within 15 seconds you've got 200 kids being able to view something that's inappropriate. It's the ability to cause harm to someone when you're sitting at home in your pajamas, using Instagram, all those media outlets, Facebook, whatever. I don't even know all. I'm Snapchatting.
Yeah.
It's the quick access that we have to be able to make someone feel bad about themselves.
Eric Johnson, making a difference in a lot of kids' lives. Thank you so much for talking to us today. Move to Stand, Stars Nashville. Thank you very much, Eric.
Thanks for having me.
Yeah, all right, nice to meet you. We'll be right back. So happy to have Dr. Karen Rae here with Centerstone talking about community-based behavioral health care, kind of a mouthful there, but so important in our community, talking about depression, bipolar disorder, and you provide services for both mental and physical health needs. Elaborate on that, Dr. Rae.
Well, I think behavioral health care is so important because behavioral health issues are very common. And I think there's an increasing awareness that behavioral health and physical health disorders impact each other. So this has been known for a long time, but there's increasing data suggesting that this is a very important relationship.
They're so intertwined.
Correct.
And that is what you're learning, the data. Elaborate on that a little bit more. For example, if someone is depressed, that's bound to affect their physical health. In what ways?
Well, I think the patients who are depressed have a much higher incidence of physical health problems. And a really important finding has been that the coexistence of depression and diabetes or heart disease increases the risk of serious disability and, in fact, of early death, much more than just having high blood pressure or diabetes might.
Does one lead to the other, though? For example, if you have a heart attack, and after a heart attack, for example, I can think about my own father had a heart attack, and it seems he became depressed after that. Was that because of being sick? Obviously you feel awful, but the lack of oxygen. I mean, I'm asking kind of a complicated question, I realize, but which comes first often?
Well, I think it can work either way, but we know that often people who have one disorder have the other. Mm-hmm. And with heart disease, we know that if the patient becomes depressed and it's untreated, that the life expectancy is lowered. So it's very important in individuals who have heart attacks or strokes to deal with the depression.
Mm-hmm. What are the signs you're looking for in these most common behavioral health issues?
Well, some of the most common illnesses would include depression and anxiety. So depression, patients present with increased sadness above what's usual in the situation, perhaps excessive crying, a sense of guilt, a sense of being worthless. These are patients who can have difficulty sleeping, a decrease or an increase in appetite. If we look at anxious patients, they present often with a sense of being nervous, restless, stressed. Anxious patients can have panic attacks where the heartbeat is racing, they're perspiring, and having a sense of doom. Also, these are individuals who have problems staying asleep or actually even falling asleep. Mm-hmm. And we know that both depression and anxiety can be underlying suicide attempts.
Mm-hmm. What do patients and caretakers, caregivers tell you that are some of the common misconceptions about behavioral health?
I think, and it's the same one we've talked about for years, it's the idea that people need to try harder, that if someone would just settle down and make an effort, that they could overcome their sadness or overcome their worries. But what we know is that depression really impacts the ability to try. It impacts motivation, it impacts initiative. And so if these are persistent and significant, they really need treatment.
And speaking of that, I know you have an integrated care approach at Centerstone. Explain how that works. What does integrated care mean?
Well, integrated care means that we attempt to treat the physical health disorders and the behavioral health issues at the same time. So we would make an effort to identify what physicians or services need to be involved in a certain patient's care, to identify the gaps in care for that individual. If that person has diabetes, we might realize they haven't had a blood sugar checked recently. So as a psychiatrist, I might need to ensure that the person goes to their primary care provider, deals with their blood sugar. And several of our clinics at Centerstone do have primary care embedded in that clinic site. Otherwise, we work to coordinate with the patient's physician out in the community.
If someone feels like they're experiencing symptoms of depression, anxiety, what should that person do?
Well, I think if it's an emergency, it's appropriate to go to the emergency room if there's suicidal thinking or intent. And for some people, it's appropriate to have a 911 call made. I think for most people, it's more chronic and recurrent, and an appropriate solution for that would be to communicate with their regular primary care physician, and then to be referred to a mental health specialist. And that might be a psychiatrist, a psychologist, a social worker, a counselor, a nurse.
And don't be afraid to do it. Don't be embarrassed to do it. You are not alone. It's so prevalent in our society. Thank you so much, Dr. Rae, for your time. We really appreciate you.
Well, it's a pleasure to be here.
Thank you. And we'll be back in a moment. Thank you for watching Community Health Matters. Learn more ways to improve your health at mycommunityhealthmatters.org. And remember, here in Middle Tennessee, our community health matters.